Primary health care is about caring for people rather than simply treating specific diseases or conditions.
ඇත්තටම හොඳ සෞඛ්‍යයක් කියන්නේ ලෙඩක් දුකක් නැතුව ඉන්න එක තමයි. ඒ කියන්නේ නිරෝගීමත්ව ඉන්න එක තමයි හොඳ සෞඛ්‍යයක් කියන්නේ.
Primary healthcare plays a really important role in preventative as well as acute care for the community, and a healthy nation actually quite well depends on a good primary healthcare system.
Good primary health care is made up of three main parts. Firstly, empowered people and communities who can take care of and advocate for their health.
My main concern is empowering people. This is the place where we can talk with the people about their health because they come to do physical activities. We are empowering people so that they can control their health into their hand.
I think it's marvellous how people can come to a place like this and not be judged. You know, to say, well, listen, you're part of this community here. That's why I love it. There was times even I didn't want to even go for a walk. You know, on Monday I might take a trip around the block. And then Friday comes, I'm here. You know, so I feel a lot better.
The second key aspect of good primary health care is ensuring multi-sectoral policy and action to systematically address social, economic, environmental and commercial determinants of health.
Empowering the citizen is equal as important as providing healthy environment, such as tobacco-free public space, healthy and safety workplace and transportation.
I think we have a lot of innovation. When we innovate and decide to combat NCD, then the MOH and the government introduce tobacco tax, increase the tax, stringent implementation of the FCTC, the Framework Convention on Tobacco Control, smoke-free public spaces, warning and fight with the tobacco industry to the last drop. That means intervention at the policy level.
ทำคนเดียวไม่ได้เลยต้องทำแบบมีเครือข่าย
Ministry of Public Health work with the Finance Ministry to introduce sugar sweetened beverage tax, which will reduce consumption of the sugar in the population and have long-term effect on obesity.
And the third area is primary care and essential public health functions as the core of integrated health services. Primary care is usually the first point of contact people have with the healthcare system. It provides comprehensive, accessible, community-based care that meets the health needs of individuals throughout their life.
I think I provide a sort of connection to patients in the local community. So we help monitor people's health, but also we're there to look at the holistic care for patients. We can connect with other healthcare professionals such as psychologists and dietitians.
It's good to have a doctor who knows from go to woe what's happening, because every time you see another doctor you have to explain all over again, where when you've got a doctor and you can stay with all the way through, it's so helpful.
My role as an Aboriginal health worker is to empower people to take ownership of their own health, and that includes making sure they're coming out of appointments with the right information.
In the light of increased elderly people, in the light of increased chronic NCD, this will put a financial constraint. So we have quite challenge to meet the health demand of the citizen in the future. I think first thing first, make the service trustworthy.
It's paramount that our people understand their own diagnosis and can tackle their own health issues within their own settings.
By committing to strong primary health care, together we can achieve health for all.